Hello, my name is Sifa Feruzi, and I am a 19-year-old sophomore in college, and I want to play a game. Let's play What Am I? The Human Body Edition. And I'm going to give you a little hint. Ready? Okay. It is an essential life force, and it is constantly flowing and keeping your body working. If you guess the blood, you're correct. Blood is that specialized body fluid that constantly flows throughout the body. It does many things to keep us warm and running, such as carrying oxygen throughout. Unfortunately, not everybody is made equal, and most functions have their flaws. There's blood cancers and disorders that may prevent blood from doing its essential work. Fortunately, there have been healthcare providers that have developed many ways to treat these ill-fated experiences. And today, I'm going to talk about one of them, sickle cell disease. By talking about how it affects the body and what we humans have done about it, and how it has impacted the science field as a whole, I am hoping to spread the word and awareness about a disorder that is so agonizing to the people who unfortunately live with it. Sickle cell anemia is a serious inherited disorder of red blood cells, which mostly affect Black and Hispanic people. There are over 100,000 people with the disorder in the US, and the condition causes a range of symptoms, including blood clots, strokes, and drastic reduction in lifespan of 20 years on average. It is caused by genetics. You get it from your mother and your father. You inherit defective copies of a hemoglobin gene, which carries oxygen in red blood cells to be subfunctional. The defect causes red blood cells in affected people to be sickled, or crescent shape instead of disc shaped as normal, limiting the cell's ability to carry oxygen. Sickled red blood cells are also more prone to clump together and cause blockages to blood vessels, carrying severe pain and tissue damage. What we humans have done about it is create specialized therapies which can control the symptoms but not cure the disease. A handful of people have been cured by bone marrow transplants from generous donors, usually someone in their family without the trait or disease, but it doesn't always work. A risk of death is huge in this, so that is why it's not an entirely reliable source of treatment. People in this area of medical care knew that we needed a better solution, and that came in December 2024 when 21-year-old Sebastian Belzi was treated with a new gene therapy called lymphedema, developed by a biotech company, Bluebird Bio. Mr. Belzi received treatment on the 17th of December and has not had any symptoms of sickle cell anemia since, leading to his doctors to believe that the treatment has likely cured the disease. Lymphedema works by extracting the patient's own blood stem cells, genetically modifying them, and using a virus to paste copies of functional hemoglobin into the cells, and then giving the patient some chemotherapy to clear out the old dysfunctional cells and then infusing the new modified ones back into the body. The red blood cells are then produced from the transplanted modified blood stem cells, and they're usually completely normal. Mr. Belzel is not the first person to be successfully treated with lymphedema in the US. Lymphedema and another genetic modification-based cell therapy for anemia is Casgevy, I believe it's called, and they were both FDA approved in late 2023 for the treatment in patients 12 and older. And following impressive clinical trials, in the lymphedema trial, which led to the drug's approval, 88% of 32 patients treated with the therapy ranging from age 12 to 50 had complete resolution of the symptoms between 6 to 18 months after receiving the drug. But, you know, after every victory, we have our upsets. And this one has to do with the price of the therapy. Lymphogenia is priced at $3.1 million per treatment. And not too much better, we have Casgevy costing $2.2 million per treatment. This unfortunately raises questions as to how many patients can actually access the therapy, but it's, it's way better than living with it. So, in conclusion, sickle cell anemia, it's not just a medical condition. It's a profound challenge that affects countless lives, particularly within the Black and Hispanic communities. And while advancements with Lymphogenia and Casgevy offer the hope and the potential for the cure, we must also confront the harsh reality of accessibility and affordability. It is very crucial for us as a society to advocate for equitable healthcare solutions that ensure all patients can access these groundbreaking therapies. And by raising awareness and supporting ongoing research, we can help bring attention to the struggles faced by those with sickle cell disease and work towards a future so where everyone can have the opportunity for that healthier life. Thank you so much for joining me in this important conversation today, and together hopefully we can make a difference tomorrow. Thank you.